Hello, welcome to Physician Spotlight. I am your host, Dr. Jay Patel. Physician Spotlights is a forum to learn more about our outstanding physicians in the field of nutrition and discuss important topics and ideas. With the help of ASPEN, we are bringing these videos to you. Our guest today is Dr. Manpreet Mundi. Dr. Mundi is an associate professor of medicine in the Division of Endocrinology, Diabetes, Metabolism, and Nutrition at the Mayo Clinic in Rochester, Minnesota. He is an expert in home PN and a rising star who has made significant contributions to the nutrition community. I'm proud to have him as a colleague and, more importantly, a friend. Dr. Mundi, thank you for joining us today.
Oh, thanks for having me, Jay. It's an honor.
Mundi, let's start by just maybe talking a little bit about your journey. Can you share with us, your journey to clinical nutrition?
For sure. And my journey has never been straightforward. I grew up in Southern California. I went to undergrad in UC San Diego and then medical school at USC, followed by internal medicine residency and endocrine fellowship there. So I really thought I was going to be a lifer in terms of Southern California, picked out my Laker tickets, that whole thing. But in endocrine fellowship, I was managing this patient who was requiring hundreds of units of insulin to manage their diabetes, and then went through bariatric surgery. And immediately afterwards, the insulin requirement decreased dramatically. Now, at that point, she hadn't lost weight, but because of the decrease in her nutritional intake, you saw this tremendous impact in terms of her metabolic complications. So this stuck a spark in me, and I talked to some of my mentors at USC and really decided to pursue a few years of research in this field. I looked around, and fortunately, Mayo Clinic has always had experts in nutrition. And so I applied and was accepted, and I did 2 years of research in fatty acid metabolism, as well as adipocyte physiology. Soon afterwards, I joined the staff as faculty. And I think within the first few months, I met Molly McMahon, who's our past ASPEN president and very engaged in nutrition. She introduced me to nutrition support in the inpatient setting, really taught me pretty much everything I know about that topic. And I started to do more of a combination of outpatient obesity practice and inpatient nutrition. Soon after, I had a patient that had neurofibromatosis, and it was involving the GI tract quite heavily. I tried oral intake, I tried enteral nutrition, nothing was working. So I put in a home parental nutrition consult, and Ryan Hurt was on the other line. We probably chatted for 2 to 3 hours, and then he introduced me to home nutrition. And the more I started to see, home nutrition patients, inpatient nutrition patients, I started to see that I was really making a difference. We all kind of strive for that feeling, but I was able to, through nutrition support, improve quality of life, in many cases, extend life. And so that feeling just kept me going, and the rest is history.
Wow, that's really fascinating. And what I really sort of admire about your story is, how you identified an immediate impact at the bedside and then tried to translate some of that back to the bench. And then from there, you came right back to the bedside. One thing that you said that really kind of stuck is sort of how you interface with individuals, along the way. So along those lines, what's been the impact of mentorship on both your professional as well as your personal, development up to this point?
Yeah, I think I've been very fortunate to get to where I am with the help of great mentors. It started with great mentors at USC who were able to provide guidance, especially leaving and going to the frozen tundra of the Midwest, to spend some time learning about nutrition. Here at Mayo, I've just been so lucky Nutrition has always been a core component of the division of endocrine. So I have a number of colleagues. Dr. McMahon has just been a tremendous mentor and guided me all along the way. And then, she also had helped me to get engaged with ASPEN as well, where I was able to meet even more mentors who, provided guidance again with different aspects of my career, such as presentations or research. There I was able to meet mentors like Dr. Martindale, Dr. McClave. I would consider you a mentor as well. I think I've texted you many a time in the middle of the night seeking guidance on a paper that isn't going right or some research idea. So I really think, without all of this community's help, I wouldn't be where I am right now.
Yeah, that's fascinating. And we hear that time and again with a lot of our, junior faculty, but also even our more seasoned faculty about the impact that just other individuals have had at various points, in their career as well. Let's shift gears for just a moment. And let me ask you, what sort of questions are you asking right now in relation to some of the work that you're doing with the home PM population? And as a secondary question, what sort of challenges have you faced in trying to answer these questions?
Yeah, absolutely. And I think, as I saw and kind of reviewed the literature, as with all of your work in the critical care field, there is a great deal of nutrition data in critically ill patients. But when you look at the home, and whether it's parenteral or enteral nutrition patients, there is not a lot of data. And I think one of the challenges is really the follow up. Many centers have expertise in placement of enteral tubes or starting parenteral nutrition, but really the data and how we change clinical practice occurs with tighter follow-up. So I think Ryan and I worked very hard from the beginning to build sort of a research platform that was embedded within the clinical practice. And we could not have done this without the entire team, team of pharmacists, dietitians, our nurses, and nurse practitioners that help care for these patients, but then also have, this spark to keep tight follow-up on patients and make changes. So with that, just recent examples, we've been able to work in the realm of lipid emulsions. As you know, the newer generation lipid emulsions have fish oil in them, but long-term data was lacking. So we were able to work in that realm and show benefit, especially in terms of liver disease for many patients if we use fish oil. Now we're investigating using 100% fish oil, Megaven, even though it's approved just for pediatric use. Sometimes we use it in an off-label manner, and that has helped many of our patients. The same thing on the enteral side. There's so much that's left unexplored, and we desperately need the research. And so we've been able to do a lot of work in the realm of what happens if patients are intolerant to enteral feeds. What's the next step? Is it blenderized tube feeding? Is it peptide-based diet? Or is it a plant-based diet? So I think we're exploring a lot of these avenues, and in the end, it's helping patients. We recently had our data published about peptide-based diet and showed dramatic reduction in healthcare utilization. So I think for me, the bench research also confirmed that passion for caring for patients, and the longer I stayed away from that, I missed it more. And so that keeps me drawing back to this translational clinical research realm.
Yeah, no, kudos to you and your multidisciplinary team for doing the work that you do. Your patients in general, have almost like a lifelong type of problem. In the critical care arena, for example, in general, critical care is fairly, temporary. And so the work that you do, I imagine just, it must be quite rewarding. Along those lines, what do you see as some of the biggest challenges as you move forward in trying to answer some of the key questions And what questions should we be asking in home PN and home EN for that matter?
Yeah, I think the biggest challenge for us is keeping our community engaged. Aspen is really leading this effort, and especially realizing that we also need to keep all the disciplines engaged, including physicians. At many institutions, because of reimbursement and things like that, you started to see decrease in number of individuals that can have the practice I have or that we have here at Mayo. We're very lucky that our institution's committed to this and sees the benefit of having such a multidisciplinary nutrition team in terms of surgery outcomes, in terms of caring for patients. But that's not the case at many institutions. So I think that is going to be our biggest challenge as a community. The second challenge is going to be just along those same lines of doing research. Research requires time, effort, and funding. When you're comparing nutrition to drug development, you can see that there's an exponentially different, funding avenue that's available. So I think that'll be our second challenge. And the biggest challenge to me is, again, that follow-up. Long-term follow-up, long-term data is really what's going to change how we manage these patients. And so I think together as a community, a nutrition community, we can all get behind these and try to do research, in a cost-effective manner. I think Darren Highland is a perfect example, leading with the effort trial, having the local sites kind of, fund and carry out the research and then combine the data to get the results that we're looking for.
Yeah, no, that's wonderful. Let me circle back to mentorship for just a second and try and tie it into kind of what you said about some of these key challenges. I imagine that there's junior faculty who are looking at your career trajectory and saying, boy, how did he do that? Because you've accomplished quite a bit in your short career so far. And so, what do you say to some of those junior faculty who are looking to do some of the same things that you're doing right now? And what advice would you have for them?
No, I appreciate you saying that, and the check is definitely in the mail. You know, um, I think to me, again, I've been very fortunate to have the mentors I've had, especially locally. But I think that's the first thing the junior faculty should look at. What sort of mentorship do I have available here at my institution? And then start to get engaged with national societies, even the local chapters. But Aspen is just a great resource, and start to become engaged there. Meet mentors. There's so many committees, that we have at Aspen. Those are opportunities for you to work more closely with, I think, experts in nutrition, who then, almost become your friends. You can have a candid discussion with them about a thought you may have, a patient you may have, or a research idea. And every time you have that interaction, to me, it's just made the paper, the way I'm taking care of patients, or that research study even stronger. And I love that criticism that I get, because it makes you go back, look at more literature, and then come back with a new approach. So that to me would be the biggest advice. I think the second biggest, and I mention this to you all the time, is that we both struggle with saying no. But a lot of times that can be quite beneficial. You just don't know which path your life is going to take, and so a lot of times when even though I'm overcommitted and I've said yes to something like a presentation, I've gone there and just met someone who then becomes a colleague or a friend or a mentor, and they give you some new ideas or someone to bounce ideas off of, and you just don't know where that leads. So those would be my two, biggest advice I could give.
Yeah, you are wise beyond your ears, my friend. And, I will say and agree that, I think Aspen and all these opportunities that come up when you're a member of Aspen certainly is the glue that kind of keeps all of this together. Um, And one final question for you here. I know you've achieved quite a bit in your short career. What's your proudest achievement so far?
I think for me, I'm so grounded in my family that that's my proudest achievement. Even though right now under shelter in place, we're doing a lot of homeschooling of my children. So I have three boys, and the oldest, I'm learning how to do geometry again and do math. And so at the end of the day, I sit there and do a lot of that. But I think, being able to have a career and a family is probably my proudest achievement. It's what really grounds me and gives me the most satisfaction.
Yeah, very well said. Very well said. And with that, I would like to thank Dr. Mundi for joining us today. I would also like to thank Aspen for their partnership for this forum. Thank you for joining us. And depending on where you are, have a wonderful day or night. Thank you very much, Dr. Mundi.